A time comes in the life of every race when people are driven by echoes of the past to chart a course for an exalted future. Africa is at this threshold, as major actors in the Africa arena plot a renaissance towards common destiny. Let's pedal across the streams of yesterday, through the backstreets of Africa to the defining roles of policymakers, the political realities of the African nation, balance of power, and the strive to sustain national interest and identity. Join us on Network Africa on Channels Television. Network Africa, the rallying point for the emergence of a new Africa.
On Network Africa this week, we'll be looking at efforts to restore peace to the Central African Republic, the Ebola virus disease, and illegal migration. In Liberia, fears mount as motorbike taxi drivers in the capital say they fear catching the deadly Ebola virus while carrying multiple passengers in the crowded street.
We are carrying people who we don't know who we are carrying, whether the person have the virus, we don't know. But to prevent this rate, we use our sensitizer, our Dettol, fore, and for each time we reach to any point, we wash our hands. For each time they give us money, before we put the money in our pocket, we wash our hands. That are some of the measures we use.
Based on those fears and more, the US President Barrack Obama has announced plans to send 3,000 troops there to help fight the Ebola virus.
Our efforts to help mobilize the international community to fight it, and the steps that we're taking to keep people here at home safe.
Then the UN is formally taking over peacekeeping operations in the Central African Republic, where about 25% of the population has fled their homes. And a Ugandan dance group is helping former street kids break out of a life of crime and poverty. Hello and welcome to Network Africa with me, C.A.R. We begin in Liberia, where the West African country is not out of the woods yet concerning the Ebola virus, with the Ebola virus death toll having reached over 2,400 across West Africa. Motorbike taxi drivers in the capital, Monrovia, now fear contracting the virus due to the high number of passengers that they carry throughout the day.
For thousands living in the bustling capital, motorbike taxis are the preferred mode of transportation. But as the country struggles to contain the Ebola crisis, many live in fear of contracting the disease.
I feel very bad because the Ebola have a lot of setback on us right now because people are not really moving like before, as you can see. And in the risks, we're carrying people around, buying things, and more people right now, we are afraid. Taking one passenger down back, and most of them they are not equipped. Like you see me at 45 already.
Ebola is a spread through body fluids such as the blood, sweat or vomit of those who are infected with the disease. Healthcare workers are among the most vulnerable to the Ebola virus. This comes after Liberia's National Defense Minister told the United Nations Security Council last week that Ebola posed a threat to the country's national existence and was spreading like wildfire and devouring everything in its path. The Liberian President Ellen Johnson Sirleaf is facing the reality that the Ebola crisis gripping her country could worsen in the coming weeks as health workers struggle with inadequate supplies, a lack of outside support, and the population in fear. In the meantime, the motorbike taxi drivers in the country say they have taken extra precautionary measures to protect themselves.
The risk involved is that we are carrying people who we don't know who we are carrying, whether the person have the virus, we don't know. But to prevent this risk, we use our sensitizer, our Dettol, fore, and for each time we reach to any point, we wash our hands. For each time they give us money, before we put the money in our pocket, we wash our hands. That are some of the measures we use. The
outbreak began last December and has been gathering pace for months. But about 60% of Liberia's cases and deaths occurred within the last 3 weeks, and that's according to reports. On Wednesday, September the 10th, the Bill and Melinda Gates Foundation pledged $50 million to support emergency efforts to contain West Africa's Ebola epidemic, the worst outbreak of the virus in history.
Now, the world is certainly not oblivious to the needs of Liberia, which has clearly been the worst hit by the virus so far. For this reason, the U.S. President Barack Obama has announced plans on Tuesday, September the 16th, to send 3,000 troops to the country to help fight the virus. From what we understand, the U.S. military will oversee building new treatment centers and help train medical staff.
President Obama went to the Centers for Disease Control in Atlanta to meet with health workers, where he announced the United States is doing its part to combat an outbreak that he said is spiraling out of control and posing a potential threat to global security.
The world is looking to us, the United States, and it's a responsibility that we embrace. We're prepared to take leadership on this, to provide the kinds of capabilities that only America has, and to mobilize the world in ways that only America can do.
The United States has already committed more than $100 million, shipped medical supplies, and deployed experts since the outbreak began in March. Now more help will be on the way. It will include 3,000 U.S. troops who will help set up and operate a military command center in Liberia and a logistics facility in Senegal to facilitate the transportation of experts and supplies.
Our forces are going to bring their expertise in command and control, in logistics, in engineering. And our Department of Defense is better at that. Our armed services is better at that than any organization on earth.
The U.S. will set up hospital facilities and train Africans to deal with the outbreak. It will also provide technology and training needed to stop the disease. While the risk that the epidemic may spread to the United States is low, Mr. Obama said Ebola could have destabilizing effect in the region and the world.
This is a global threat, and it demands a truly global response. International organizations just have to move faster than they have up until this point. More nations need to contribute experienced personnel, supplies, and funding that's needed, and they need to deliver on what they pledge quickly. Charities and individual philanthropists have given generously, and they can make a big difference. And so we're not restricting these efforts to governmental organizations. We also need NGOs and private philanthropies to work with us in a coordinated fashion in order to maximize the impact of our response.
Aside from controlling the epidemic, President Obama's strategy aims to blunt the economic and political tolls on the region. Liberia and Sierra Leone are still recovering from devastating civil wars. The U.S. President on Tuesday called on other countries to make good on their commitment to send more personnel, supplies and money and seize the opportunity to save countless lives.
Also, the fact that there has been criticism for the slow international response to the Ebola epidemic in West Africa might have also played a significant part in the response of President Obama as well.
More than 2,400 men, women, and children are known to have died, and we strongly suspect that the actual death toll is higher than that. Hospitals, clinics, and the few treatment centers that do exist have been completely overwhelmed. An already very weak public health system is near collapse in these countries. Patients are being turned away, and people are literally dying in the streets. Now, here's the hard truth. In West Africa, Ebola is now an epidemic of the likes that we have not seen before. It's spiraling out of control. It is getting worse. It's spreading faster and exponentially. Today, thousands of people in West Africa are infected. That number could rapidly grow to tens of thousands. And if the outbreak is not stopped now, we could be looking at hundreds of thousands of people infected, with profound political and economic and security implications for all of us.
Well, Sierra Leone is also paying a very high price. Since the advent of the Ebola virus disease, the country, which was once a popular destination with tropical rainforests and palm-lined beaches based on the outbreak, would-be tourists are now avoiding the West African country altogether, and the once popular beaches are now deserted.
Freetown's growing tourism industry has taken a serious blow from the Ebola virus that continues to ravage the West African nation. With the World Health Organization estimating the Ebola outbreak to last for months, many local businesses like the Kona Lodge Hotel have been left with no choice but to lay off employees. Chief Ernest Ndomina is the Chief Executive Officer of Kona Lodge. He says he is struggling to stay afloat.
It's a serious situation. It's serious to the extent that we had to lay off our staff because we cannot maintain them anymore. We cannot maintain the overheads. We cannot maintain the running costs of the business. And so we have to shut down, and we asked our staff to go.
Sierra Leone, Guinea, and Liberia are among the poorest countries in the region and the hardest hit by the worst Ebola epidemic on record, which has killed upwards of 2,400 people. The Sierra Leonean tourism industry had been growing steadily since the end of their civil war in 2002, earning an estimated $41.7 million and employing 5,622 people in 2012, according to the country's National Tourism Board. In the face of the deadly disease, business has slowed down, airline flights have been suspended, and the government's weak health system is struggling to contain a disease that has killed over 500 people so far in the country. The International Monetary Fund (IMF) has said economic growth in Sierra Leone was likely to fall to 8% from 11.3% this year. Even large hotel franchises like Radisson Blu are reeling from the lack of tourist income. Closing entire sections of the hotel and keeping the lights off are just a few of the measures that the Radisson management is taking in order to stay open for business.
We have shut down some floors because we are not occupying them, the rooms. We have shut down the meeting rooms. We have shut down some lights and some corridors and some guest areas. We have scheduled